Hello, welcome to Treatment Tuesdays. Today we are going to focus on lateral epicondylitis, or better known as tennis elbow. Basically pain on the outside of your elbow. And we're doing this in preparation for upcoming elbow pain workshop that I'll be giving the 15th of November. And we'll include this in more detail as well as some other issues in the elbow. Today, this is going to be a pretty brief just overview of what lateral epicondylitis is and a couple things to try on your own. By no means is it meant to replace a full evaluation, but hopefully you'll get something out of this. So the lateral epicondyle is that bony structure on the outside of your elbow right here, and you can kind of feel it when you palpate your elbow. And the significance of this is there are 4 little muscles that all come and connect to the same area. So you have your extensor carpi radialis brevis, you have your extensor digitorum, your extensor carpi ulnaris, and extensor digiti minimi. You have a bunch of other muscles that connect around that area. You can see extensor carpi radialis longus here, but those 4 muscles all connect to that same area, that white tendinous area here. And why that's important is as we start to use our muscles, if we overload them in some capacity, they're going to break down at the weakest point. And because all 4 of those muscles connect to that same place, that tends to be the area that becomes painful. And so those 4 muscles, their main purpose is to extend your arm. So if I'm looking at my arm here, extend your wrist. So anything that brings my wrist up is going to be activating those muscles. Same thing with bringing it out to the side. And so this is often used with golfing. You see it with people working on mechanical things, even sometimes gripping. And so anything that brings that wrist up when this is irritated potentially is going to make this worse. Things like lifting a bag. If you have to lift, flip over so palm is up as opposed to palm down will make a difference. And just avoiding those repetitive motions. Now, if you think about those 4 muscles and where they attach, one of the most important things is to make sure that they have enough mobility. So if they're too tight, they're going to be pulling on that area. And so doing some gentle form extensor stretches, which I'll show in a minute, is important, as well as working on strength. So they have to be able to accept a load. And any kind of tendon that has an irritation, you typically start with an isometric contraction, meaning you contract the muscle against a load without it moving, and then progress to an eccentric load. And what I mean by that is use the muscle as it's lengthening as opposed to when it's shortening. So if I want to stretch my forearm, specifically those extensors, I'm going to do the opposite of their action, which is coming up this way. I'm going to pull my hand down. I usually have people start with their elbow bent and then slowly extend it. If you get to here and you don't feel much of a stretch, then you can actually twist the hand slightly towards the pinky to get a better stretch, but you should feel a nice gentle stretch coming anywhere through that top of the forearm. Now, if it's just painful in the elbow, you need to back off a little or calm it down a little bit more with some icing or massage prior to doing this. If it feels okay, this is something to be doing multiple times throughout the day. So that's your stretch. The isometrics I was talking about, your arm would be supported on something. You're going to use your other hand and you're just going to push up into my hand, hold it for 5 seconds, and relax. Push and relax. If that feels okay, the progression would be eccentric, so you would bring it up into that shortened position. Then I'd place my hand on top. I'd apply resistance, but I'd let myself win. So I'm going all the way down, take the hand away, come back up, apply resistance, resist, but let myself win, all the way down and back up. And you do a set of 15 of these and slowly work up to 3 sets of 15. Other things that can be helpful with lateral epicondylitis are wearing a tennis elbow strap. And so you've seen these sometimes for the patellar tendon, but also here, the strap goes right over the muscle. And the idea is you have this big long lever arm for these muscles, and the strap actually pushes down on the muscle and creates a shorter lever arm, so it doesn't pull on that tendon as much. You will know right away if this is helpful. So I tell people, go down to Harry Race, go to pharmacy, grab one, put it on, do something that normally irritates it. So gripping or lifting or resisting that extension, and then put it on and test it again. If it's helpful, then wear it. If you're unsure, it's probably not going to be helpful for you. There are certain taping techniques that help here, and also just massage. So any kind of massage through that muscle belly to help kind of loosen it up, and something that's called cross-friction massage over the tendon itself can be very helpful. As always, icing and basically your icing and resting can be helpful. If you want to learn more tricks, come to my workshop on the 15th from 12 to 1, in person or online. $25 for public, and it's free for any of my wellness group members. All right, thanks so much. Bye.